The aorta is really the major highway of blood flow. It's the major blood vessel in the body.
Every single organ in our body gets blood supply through some branch or vessel that comes off of the aorta. So in many ways, it's its own organ. There are discrete diseases associated with the aorta that are important to carefully manage and treat.
The aorta can harbor disease for a long time before it can cause any problems for the patient.
A lot of the diseases that affect the aorta are silent diseases, meaning there's a disease process that's undergoing where often patients don't know that it's happening.
And these aneurysmal changes can happen at a variety of different locations in the aorta, and again, that depending on that location, the treatment options and approaches may vary widely.
The problem with aortic disease is that we don't have any clinical sign for the most type of aortic disease early on. So it's very possible that patients are carrying, for example, an aneurysm of the aorta or an ulcer in the aorta for a long time, and the first sign is a complication such as a life-threatening rupture or dissection.
The treatment modalities for the aorta based on the pathologies is also very dependent on where anatomically the problem is.
Endovascular surgery changed the scenery for aortic disease. There's still a major role for open surgery because endovascular surgery is not suitable for everyone. And there is an area in between where we can offer to treat part of the disease with open surgery and the other part of the disease with endovascular surgery, and we call that a hybrid approach to treating aortic disease.
There are multiple ongoing clinical trials pertaining to the latest and greatest in stent graft technology that we are a part of. There are branched and fenestrated technologies that are being made available to us that can be deployed in the ascending aorta and the aortic arch, an area of the aorta that was previously deemed solely appropriate for open surgery, now accessible for minimally invasive stent graft technology, which is quite remarkable.
We've really made a huge progress in offering our patients a wide array of treatment options so we can think about tailoring our care to the patient. At the Aortic Institute, we are keen on, and our main mission is to approach every patient in a multidisciplinary way, where the appropriate teams are involved in the care of the patient, and we make joint decisions on how best to care for patients.
As a vascular surgeon, we do tend to get involved in those portions of aortic disease in collaboration with our colleagues in cardiac surgery.
We have a lot of interest in learning how to screen and diagnose aortic disease before it turns into a problem. So we have a lot of research focus on the prevention aspect of aortic disease. Another aspect is on understanding the evolution and the growth and the behavior of the aorta as an organ. You know, every day we learn something new about the effect of genetic mutations on aortic disease.
We've had a series of patients who were given a diagnosis of severe advanced aortic dissecting aneurysmal pathology. They were told that there really was no other options for them and that they should seek hospice or comfort measures only. And we were able to provide really durable, lasting treatment options for them in the least invasive manner possible.
This kind of hybrid approaches and multidisciplinary approach allows us to address very complex aortic pathologies in patients who have a lot of comorbid burden in the safest way possible.
It is extremely satisfying to be able to be available and help patients in time, patients who are suffering from truly life-threatening disease, get them through the operation, through the recovery period, get them back to their loved ones, and carry on with their lives, and at the same time offer awareness and screening and surveillance for them and for the rest of their family members.